Hi, and welcome to A View from the Bed. This is a CHI St. Vincent podcast where we talk to real patients about their healthcare perspective. We know that your healthcare journey can be scary, so that's why we want to get their view on the good, the bad, and the ugly from diagnosis to recovery. Enjoy today's episode. Hi, and welcome back to A View from the Bed. And today we're talking to Fran about her experience with a tumor that was in her stomach that turned out to be cancerous. So, Fran, thank you for joining the podcast today.
Thanks for having me.
So, kind of tell us where it all started. Like, what went on that you even thought something might be wrong?
Well, I was having a constant pain in my upper left abdomen area, and it would maybe subside a bit, but over time it would come back and it would be stronger at times. And finally, it got to a point where it was painful. So the doctor, my GI, had already asked me to do an upper GI. So I went ahead and had my annual colonoscopy, and then I had the upper GI done. And that's where they found the neuroendocrine tumor that was causing all the problem.
Okay. So when you say discomfort in your upper left abdomen, what did that feel like? Did it like burn? Did it hurt?
It was a pressure, kind of felt like something was stuck up in my rib, kind of a little bit. And it was, but there were times where there was a little ache to it, like, not quite a burn, but it would be inflamed. You could just tell it was irritated.
Did it hurt more like when you ate? Or did you notice a difference, like if you ate or didn't eat, or was it just kind of at random?
No, eating didn't really have an effect on it necessarily. There were probably times where eating actually made it feel a little better, but there's no science to that.
Okay. Yeah, who knows? I mean, they say potatoes kind of coat your tummy. So,
there you
go. Maybe that baked potato
it
made
helped.
a little bit of a difference. So, talk a little bit about the emotional side of when you hear the doctor tell you after your scope and your colonoscopy that they found this tumor.
Sure. We had a consultation right after because it was obvious that she had found something. She didn't feel like it was anything too bad, nothing on the metastatic scale or anything like that. So I felt pretty okay about it until a couple weeks later when she called and the labs were back on it and said that it was a neuroendocrine tumor, could be caused by different things. Medication is one of them, because I do take one of the things could have been omeprazole that I take on a daily basis. But then I also, for other ailments, I also take biologics, or I did.
Okay.
And the biologics are definite. They can definitely cause the neuroendocrine tumors.
Okay.
So we never really got a definitive, but I am off biologics. I can't take those anymore. So that has really changed my treatment for my other things I deal with. So that is a blessing. While, the treatment for those, it was successful, for the outcomes there, but, it is what it is, and you move on. So, but, I do continue to take the omeprazole. The oncologist that I was seeing, he feels confident that it probably was not the omeprazole. So, so I'm moving on with that. As far as the psychology of it, when she called me and gave me the news over the phone, I felt better too, just because if it's bad, it seems like they call you in, and talk to you.
Have you come in?
So I felt pretty good about that, it was something that can be fixed.
Yeah.
So from there, it was just finding the right oncologist, which was Dr. Gaboli here with St. Vincent, and getting connected with the surgeon.
Oh, yeah.
To remove it. And all of that happened so fast. It was, I was very thankful for that, that it was discovered in late September, got the actual diagnosis early October in with the oncologist, and I was having surgery the 1st of November. So, and then I was cancer free.
Very fast.
Very fast.
So before we get into the surgery portion of it, we always ask people, did you go to Dr. Google? When you hear the words, neuroendocrine tumor, did you go to Dr. Google?
Oh, yeah. I'm big about Dr. Googling.
Was Dr. Google helpful?
Dr. Google was helpful in some respects.
Okay.
I mean, you don't want to take that, to a crazy level or anything, but it's great for facts, and if you go to the right website on Dr. Google, then you can get some good quality information.
Yes. So, if you stick with reputable resources, when you Google health information, that's always the best. If it says Wikipedia, just bypass it. And for those of you that are wondering what is omeprazole, it is a generic form of a Prilosec. Antacid preventative. So just to clarify that. Okay, so super fast.
Yeah.
So not a ton of time to process it.
No.
With Dr. Gaboli.
Mm-hmm.
And then did Dr. Gaboli do any extra tests or?
He did a lot of labs. Okay. And I learned a lot from the labs that he drew. And I think that's kind of where he became more comfortable with the omeprazole versus the biologics that I was on. So the labs, I mean, it's amazing. The service that you get at the cancer center, the labs are pulled when you go in for your appointment, and then you sit down with Dr. Gaboli, and he has the results for 95% of those labs.
Oh, that's awesome.
So it's really helpful.
Yeah.
It was, it put me more at ease. I trusted him. I felt from the beginning that he knew exactly what he was doing.
Yeah.
And was very worthy of my trust and all. So he was a great resource, and I'm still following up with him.
Okay.
At this point, we had the post-surgery, I believe it was in December, and then I had a 6 months from surgery, and then I'm out to a year now. So
that's great.
Yes.
So he looked at your labs and he decided you needed to have surgery.
Mm-hmm.
And so he hooked you up with Dr. Hida.
Yes.
And Dr. Hida is super cool because most of the surgeries that he does is through a scope. And so tell us a little bit about that. Like when you realized how it would be a little different than what people think of as an incision type surgery.
I was worried about incision, and that sort of thing. It's something, anytime you're opened up, it's worrisome. So I, again, was very thankful. Things just kind of went so smoothly for me that Dr. Hida could do this type of surgery the way he was going to do it. And, it was really so easy.
Yeah.
I just went in that morning, and they did their normal anesthesia stuff. And before you know it, Dr. Hida came in for a consultation, and I was out.
Yeah.
And when I was became awake from in the recovery room, I just, I felt so lucky. They told me it was all easy to get and
awesome.
all was taken out and it was going to be sent off and it was the same diagnosis as before
Okay.
once the labs came back.
Well, that's exciting because since he was able to do it, so Dr. Hita is an advanced endoscopist, which means that he can do GI type surgeries in a very non invasive way. So, like Fran said, a lot of times he goes through a scope and is able to do lots of different types of procedures that way. Um, the great thing about having this type of a surgery with someone like Dr. Hita is this is all that they do. And so they're very familiar with your GI system and the ability to get tumors inside your stomach in a very successful manner, which is phenomenal. Because what was your recovery downtime?
Um, Really nothing. I mean, I was back to work the next day, I believe. It's hard to remember now, but I really had no downtime.
I mean, that's amazing.
To have cancer removed from your stomach and to be back up and running the next day, it really was amazing.
I mean, hopefully, you took some time to sleep, off the anesthesia
Yes.
the rest of that day.
That day. Yeah.
Was there any changes, in your eating that you had to be careful of afterwards since they did remove?
Um, just a couple of days worth of, the bland type diet, keeping it, um, nothing hard to, where you'd have to chew it and it would have to be digested. So
Okay.
just easy things,
Real soft.
real
Soft
soft.
foods, no hot sauce,
Yep. No hot, no hot
no
sauce.
peanuts, nothing crazy hard, or
No.
you didn't go out and eat a big old steak afterwards. You gave
Did
that a
not
couple
feel like doing that. That's for sure. So, oh,
Well, that had to be such a huge relief, not just when you hear the words that they got it all, but then when you know that it was the diagnosis, which goes back to just the thorough process beforehand.
yes.
And now you have a plan for follow up to just make sure.
That I stay cancer free.
Yeah.
And that it's easy to do.
Yeah.
Especially right here at CHI St. Vincent. It's all in just a short distance. So I don't have to travel far
Yeah.
and and I'm just very thankful for that.
No, that is huge, when it's, your oncologist is in one place, but the surgery is within a couple miles and
Yes.
where you have some familiarity and easy for our families too.
Very.
So, well, that's really exciting.
Yes. It's sometimes I forget about it nowadays. Last year, this time the pain was kicking in, and I remember, thinking, is this going to be a big deal or, is it just me? Is it just something I'm dealing with? And while it ended up being a big deal, the outcome, the process and the outcome couldn't have been any better, smoother, um, wonderful.
That's right. It was just a God thing.
That's right.
100%. Well, thank you, Fran, for joining us on A View from the Bed. Your story is super inspiring because you just show us one, when you look into the right resources and have the right team, surgery doesn't always mean an incision. Surgery doesn't always mean a big downtime. But every episode, we always say, if it doesn't feel right, it's probably not right. So pay attention to your signs and symptoms. If it's out of whack, you need to go see the doctor, talk to your doctor, because we want to catch something before it becomes a big thing. And then if it is a big thing, like in Fran's case, we can do something about that and put you on a really good treatment plan and outcome plan. So thank you again.
Thank you very much for having me.
Yeah, you're welcome. And guys, let's see. Next month, I don't know who we're going to be talking to. So that means you're just going to have to tune in and see what it's all about. Could be rehab. It could be orthopedics. You never know. Also, if you would like us to cover a topic, you can always leave us a comment under this YouTube video and give your suggestion for what topics you would like for us to cover. Because we know that sometimes the best way to make a decision about your health is to hear about the experiences of others. So please send it to us. We would love to hear about it. And thank you. Until next time. Thanks for joining us for today's episode of A View from the Bed, A Patient's Perspective. We hope that you found it helpful. We hope that it helped you make your healthcare decisions. We hope that it made you feel a little more comfortable with your own journey. And we hope that you'll join us next time.